The blockage of humanitarian aid is having appalling consequences for of course, for 1 million children in the Gaza Strip. No aid has been allowed to enter Gaza since March 2nd, 2025, representing the longest period of aid blockage since the start of the war, leading to shortage of food, safe water, shelter, and medical supply. Our reporter Mamadi Barno has more details of that in this report.
The breakdown of the ceasefire and resumption of intense bombardment and ground operations in the Gaza Strip has reportedly left 21 treatment centers, 15% of total outpatient facilities, closed since 18 March 2025. The 350 children relying on these sites now face worsening malnutrition, which can be life-threatening. Most of these kids were displaced, sheltering in makeshift tents and damaged homes. Children receiving malnutrition treatment are at serious risk. Complementary food for infants, crucial for growth when food stocks are now low, has run out in central and southern Gaza. Only enough ready-to-use infant formula remains for 400 children for a month. The UN Children Agency UNICEF has estimated that nearly 10,000 infants under 6 months require supplementary feeding. So without the RUIF, families could be forced to use alternatives mixed with unsafe water. Amid this prevailing situation, humanitarian organizations are working tirelessly to protect and support children under these horrific conditions, but continue to face attacks that have killed and injured hundreds of aid workers. These attacks are said to be in violation of international humanitarian law and jeopardize the continuity of crucial life-saving operations for those in desperate needs. Despite the ongoing risk, UNICEF is committed to continuing to provide humanitarian support to children and their families depend on for survival and protection. Accordingly, UNICEF has been forced to scale back mental health and psychological support, education, and child protection case management due to ongoing hostilities and mass displacement. Despite an extremely challenging situation, the United Nations Children Agency and its partners are keeping a crucial presence, delivering services like resumption of neonatal healthcare service in the north and providing 21 respiratory masks to save the lives of 150 newborns, increase access to drinking water for hundreds of thousands of people, addressing malnutrition with more than 7,800 children under 2 years old, rich with ready-to-use complementary food, and more than 33,500 screened for acute malnutrition, prevention of family separation, with more than 300 children reunited with their parents after having been separated by displacement orders and intense strikes. Meanwhile, UNICEF is urging states with influence to use their leverage over the parties to stop the conflict and ensure their respect for international law, including special respect and protection due to children affected by armed conflict. Reporting for Eyeafrica News, I am Mamadi.